There's no lid lag, the eyes open equally, so that's the exam of the face and head. We're going to move on to the eyes, and first of all we're going to test for visual acuity with one of the handheld charts that I don't have one of those either. So there's one that is for 6 feet. Perfect. And this one says that you hold it 6 feet from the eyes, so we would pretend that we're 6 feet away, and I'm going to ask you to cover your right eye with your right hand and read the smallest line that you can.
LTSPH.
Okay, now cover your left eye with your left hand. And can you read that same line and backwards?
HPSCF.
Very good. So that's visual acuity that we've tested.
Have them cup their hand when they cover the eye, not flat, because if they press on their eye, they're going to change the focus. So,
right. Ask them to cup it.
6 feet. How do you find 6 feet? The tile in the floor are 12-inch tiles.
Okay.
That's 1 foot.
Very good.
Okay. 72 inches?
It's a 14-inch, yes. Yes.
Yeah, just make sure that you're using the right distance for the right card, that's all.
Right. Right. And then we could also say that, can you tell me what color this is? And this is green. So we did color blindness as well. All right. And then we're going, I should have asked her if she wears glasses. Contacts, and they're in. So you would just write that her vision is 20/20 with her contacts in. I'm not going to ask her to take her contacts out today. And then I'm going to just visually inspect her eyebrows and notice that they're both equal, that they go out to the periphery and they're symmetrical. And they need to be tweezed. Get on that. Then her eyelashes look symmetrical. There's not a lot of missing lashes or any problems. And then I'm going to pull down her lower lid to look at the conjunctiva and ask her to look up. And I see that the sclera are nice and white. There's a little bit of injection, but the conjunctiva are nice and pink. There's no masses. There's no discharge. There's no pus or extra tearing. Then I'm just noticing her pupillary size. And in this light with her brown eyes, it's very difficult to see the exact pupil size. So I'm going to shine a light and see if I can see that they're the same size. So yes, they are equal. Okay. And then I'm going to look obliquely at the corneas and just see that the corneas are clear. And that's just a covering of the eye itself, and that the corneas are clear, but you look at it from the side. And then I'm going to use the direct and consensual reaction is how well do the pupils constrict to light. So I'm going to cover her eyes, and I'm going to shine it first in the right eye and notice that the right eye constricts, and then I'm going to shine it in the right eye and notice that the left eye constricts. Okay, and the same thing with this. I'm going to shine it this way and notice that it constricts, and then I'm going to shine it again. See how I do it from the side, and then notice that the left eye constricts, the right eye constricts. So when you shine, that's the indirect or consensual reaction. And then I'm going to test the extraocular movements. The book describes an H shape that you can do it in, but it's the way I always do it. You just go across and backward, up, down, this way, that way, up, and down. And then right into your nose, and you notice that the eyes come together and the pupils constrict as they come together, and that's the accommodation. Okay, the convergence and accommodation. And then I'm going to test the visual fields. We need to be about the same eye level, and we're just going to look right in each other's eyes, and I'm going to say, tell me when you, I'm going to put my arms out here, tell me when you see my hands move. And at the same time you see them, they should see them. If you're in here and you can see it and they can't, then that's some visual field defect. So we should be able to, you do it in all directions. You come from the bottom, I see it, okay? And you come straight in. That's visual field by confrontation. And then you can just palpate for the lacrimal duct up here, and then the inside in here, and notice any swelling, any discharge. When you push here, if there's a discharge, discharge that comes out of the lacrimal duct, the punctate right there, and that might be some kind of infection within the lacrimal duct or gland or something, okay? That's where the tears are. Okay, so next we're going to go to the fundoscopic exam. I would dim the lights if you could, well, if we turn off the lights in the audience, I see what I'm doing. So dim the lights though when you're doing it yourself. You turn on the ophthalmoscope with the little, push down the button and turn it around, and you'll see, I always shine it on my hand to see exactly what aperture is there, because this dial back here changes the apertures. You see the large circle? This is the one that has the lines on it. The slit lamp, the black lamp, the small, the medium, and the large. So I would use the largest aperture. Start this at 0. This, the diopter change is what you use to focus the image in the patient's eye, so that sometimes if they are myoptic, you're going to need to go into the green, if I remember correctly. And if they are hyperoptic, you're going to need to go into the red. So
just go whichever way works.
Right. So start with the 0, and if it's very blurry, just start turning the wheel, and if that doesn't make it better, turn it the other way. That's the way I do it.
Yeah, young people tend to be nearsighted, older people tend to be farsighted.
Farsighted. And the hyperoptic is the farsighted.
Yes.
So, and I've never seen these buttons back here, but I've since learned that this makes all of the light green, which I'm not sure why you do that, and then this one makes it not quite as bright as the middle one.
The green light helps bring up AV nicking and things like
Oh.
that. It turns the red black.
Okay, so the way to do this, I always take off my glasses. First, you're going to look for the red reflex. So you have to look through the opening.
That's the other thing. You can use the diopters to correct your own vision, too.
Right.
Seriously. You
Right.
may have to. Or
So
you
you're going to
won't
look for the red reflex, and you should see the light red in her eyes, which is just a reflection of the retina.
see. Just like in a picture. When
And
you
then
take
you
it, the red
go
eye.
in to the side, ask the patient to look straight ahead, and then you can see all the blood vessels, and trace the blood vessels back to the center, and there's her optic disc. Good job. And then you can go up to the periphery and out temporally, and you should see the macula and the fovea. Okay? And it just takes a little bit of practice. Go in from the side, ask the patient to look straight ahead and try to keep their eyes still and stare straight ahead. Go in from the side and then come in to the front. Okay? It will probably take you a few efforts. And I learned that in your lab bags, there's a little plexiglass box, which is like an eye. And you can use your ophthalmoscope with that box and look right into it as I was doing with her eye. And it's very realistic. So you can practice that without blinding your friends. Or family. They would appreciate that. So we will be practicing that. For the ear exam, first we're going to just inspect, and we're going to look for any deformities, lacerations, abrasions, drainage, swellings, rash. Yes, I'm sorry.
Wasn't there a consensual light test where you shine the light in one eye?
Yes, I did that when I did this, and I shone the light.
Oh, I thought that was.
No, she's talking about, I think with the pen light, you know how it's supposed to, like, just shine it.
Oh.
Test for strabismus?
Yeah, you can do that. Is that
I don't know if it's on there. I know we covered it in like.
Yeah, it was a
Yes.
lecture.
Okay, you can shine the light. I'll show you. Just look at my nose, and if you shine the light,
But is that part on the exam?
I don't think it is. That's or else I would have done it.
They're not going to
No.
Right, exactly.
typically do what you
No.
need to do first and look over just to ensure it's not lateral. Yeah, without lateral.
You need to have it a lot darker than here because you want to be able to see, and her eyes are so dark brown that it's hard to see the pupils. But you just shine it here, you shine it, and it should show up the same in both pupils. If you shine it from one angle, from one distance. But it's not part of that. So we're just first for the